Mental illness can affect anybody at any walk of life, from students who just returned to school to the elderly. The Mental Health Center of Passaic is a community-based nonprofit organization with a network of programs helping adults, children, and families to improve mental health and well-being. Joining us now is Christopher Alcazar, the Executive Director of the Mental Health Center of Passaic. Welcome, Christopher.
Thank you. It's good to see you.
Now, how could a parent or a caregiver start to dialogue with their child about something as serious as depression, anxiety, and any other mental health concerns?
I think the advice that I try to give parents is to find a safe space and time to have that dialogue, that conversation with their child or children. They need to find ways to validate their feelings through active listening. I think the key would be to listen more and to talk less when you're having this conversation. Obviously, the other things that they should do is to find the right time and the right place to do it. Having that conversation at the dining room table when you're having a meal is not the right time to do it. It should be in private, and it should have the seriousness that it deserves. Another thing is to acknowledge their feelings. This is a very difficult and significant issue for a lot of our children, despite that we may think it's not so serious. So a simple way to do this, to acknowledge their feelings, is to just paraphrase or mirror what they're saying to you. So, for example, if a child says, "I'm upset" or "I'm sad because I missed the bus to school this morning," it may sound like nothing to us, but it may be very important to them. And one way to acknowledge their feelings is just to mirror what they said, and that could go something like, "So you're upset because you missed the bus and you were late for school." So that sort of opens up the dialogue with respect to having that conversation. The other one is, don't minimize their concerns. Don't say things like, there's nothing to worry about, that happens to everybody, or everybody feels that way sometimes. I think it's important that you validate how they're feeling.
And on that note about validating, what can we do as individuals to stop perpetuating that negative stigma about mental illness?
Well, so stigma is a set of negative and often unfair beliefs about a certain group of people and by another group of people. So folks with mental health concerns experience stigma in a much greater way than many other groups. And so this is deeply concerning because stigma can, just turning something off here, I'm sorry. Stigma can prevent someone from actually seeking help. That's because stigma is very closely related to shame and rejection, and the fear of being labeled as different. So some of the ways I think that people can stop perpetuating the negative stigma about mental health is to be conscious of our language. We should avoid the words that we always use, right? We label people as crazy or nuts or weird or strange. We should stop doing that. We should be respectful. Labeling people is not a good idea. Another thing is to educate yourself. I think learning as much as you can about mental illness and then start sharing that information with your circles is very important. Nowadays, we have something called the internet, right, which gives us all this information at our fingertips. So this is a great opportunity to educate yourself. Another one, and this is it's really about just showing compassion. We need to be able to treat everyone with basic human dignity. So remember that people won't always remember exactly what you say to them, but they'll always remember how you made them feel. That's something that my mother taught me. So it's very important that we always be cognizant of that, because people will remember what you say to them or how you made them feel, even years after the fact. So the other thing is call out negative stereotypes. When one comes up in conversation, despite that there may not be someone who is obviously in mental health or having a mental health concern, call it out. When you're having conversations with your friends and they're talking about someone, they're referring to them as nuts or crazy or insane, give them the education that you've learned that that's not appropriate. And lastly, I think you should be an ally. I think speak up whenever you see instances of intimidation or bullying. Be an ally to that individual.
Such important information about how we can be a better ally, safe space, and community member to those around us. And could you share some data on the impact that the Mental Health Center of Passaic has had in serving North Jersey?
Yeah, absolutely. In 2023-24, the Mental Health Center of Passaic had provided comprehensive mental health assessments and treatment to over 3,000 individuals. And this is primarily for folks in the North Jersey communities and neighborhoods, totaling about 45,000 client visits for treatment. We really have a fantastic network and a number of locations where people can provide and get where people can get these services for mental health. Also, 55% of the individuals we treat in our network are in our programs are actually children and youth under the age of 18. That's particularly important because I think in the heels of the pandemic, I think we have to understand that children and youth are really affected by mental health and behavioral health concerns in a much greater way than they are in the past. I think that's it for now.
That's certainly
Christopher.
more than enough and a lot. We thank you for all you're doing for the community. Christopher Alcazar, Director of the Mental Health Center at Passaic, thank you so much for joining us today.
Thank you so much.